All right, good morning. Thank you so much for joining us for NAMI Maryland's 39th annual conference. My name is Bill Fluke, and I'm a volunteer with NAMI Maryland. I'll be your moderator for this session today. This workshop session is Psychiatric Urgent Care, a resource for evaluation and linkage to care, presented by Lynn, Stefanowicz, Vedrana, Hodzic, and Laura Eskander, MD from Sheppard, Pratt. You can read more about our amazing presenters, including their full bios, in the digital conference program on the official conference website. Psychiatric Urgent Care is a vital resource for individuals seeking assessment to determine immediate care needs. The presenters will be discussing what services are offered by Sheppard Pratt Psychiatric Urgent Care and who would most benefit from this service. The presentation will address the decision of when to use urgent care versus seeking emergency services in a hospital. If this is not the workshop you meant to attend, please click the back button on your browser or click on the conference drop-down on the left side of your screen and select sessions from the menu to return to the full list of workshops. We'll be addressing questions at the end of the presentation. If you have any questions as we continue, please post them on the social wall on the right-hand side of your screen. We'll be reviewing questions as they come in, and if something in particular is unclear or needs to be expanded, we'll ask our presenters after the presentation is concluded. If you have any comments, concerns, or technical issues, please post them to our social wall, and our technical assistants will address them accordingly. When posting on the social wall, please be aware there's a 20 to 30 second delay between the presentation and the stream. When this workshop session closes, you'll be prompted to fill out a brief survey. If you'd like to receive CEUs for this workshop, you must complete the survey in order to qualify. And I'd now like to welcome our presenters for today's workshop, Lynn Stefanowicz, Vedrana Hodzic, and Laura Eskander.
Thank you, Bill, very much, and good morning to everybody. And thank you for your patience this morning. You know, we are 3 presenters in 3 different physical locations with tech support coming from 2 different locations. It's our new world, and they did a great job. So thank you, Judy. You did a great job in getting us up here and running. And we're really excited to be able to be here today on behalf of Sheppard Pratt to be able to talk about psychiatric urgent care and the role that we play as a resource in the wealth of behavioral health services that are available in our community, and specifically through Sheppard Pratt, and also the role that it plays if you're in the process of a mental health recovery. How do you gain and have resources towards your wellness? So we're very excited to be here and thrilled to be a part of this NAMI conference this morning on this beautiful Friday morning. I'd like to talk just a little bit about my background and then that of my 2 clinical colleagues. I'm Lynn Stefanowicz. I'm trained as a social worker, and I've been with Sheppard Pratt now for about 16 months. Came here from New Jersey and came from a very large healthcare system there. So it's exciting to be working for an organization that is so focused on behavioral health. And it gives me a particular view of psychiatric urgent care in comparison to receiving the services through an emergency department. So that is really what I'm going to bring to the table and talk about today. My role here at Sheppard Pratt is as Chief of Access. And in that role, I do have the responsibility on a daily basis for the oversight of the psychiatric urgent care clinics from an operational standpoint. I also oversee admissions to our inpatient beds at our 2 facilities, the one here in Towson and the new one down in Elk Ridge, the Baltimore, Washington campus. And I also oversee day hospital services. And we are all very much working side by side to bring care to people throughout the region. Along with me today, and they'll introduce themselves a little bit further, I have Dr. Laura Eskander. Dr. Eskander is the medical director of the Psychiatric Urgent Care Clinic that we have at our new campus at Baltimore, Washington. And she is also the chief of the coastal unit there, and that's the unit where we serve young adults on an inpatient basis. And also joining me is Dr. Vedrana Hodzic. She is in the role of overseeing, from a medical director standpoint, the psychiatric urgent care here in the Towson campus. And she also has another awesome responsibility, and that she is a director in the psychiatric residency program that we have. So she's bringing along the future psychiatrists. So what is psychiatric urgent care? And as we prepared this slide, of course, we're coming at it from a sort of a technical professional standpoint, but I had a few moments to sort of reflect on this morning as I was mulling over and obsessing about this presentation and what I really wanted to say. And it brought me back to where my little seeds of being involved in behavioral health started. And that was, I'd hate to say, 40 plus years ago, when I was on the campus of a college in upstate New York. And one of the first things I ever got involved with was peer counseling. And I can really remember sort of getting involved in that and saying, hey, this is a great opportunity to meet some people and learn a little bit. I became a psychology major, and it was the Empathy, Assistance, and Referral Service, or EARS. And from that, I also then got involved in that community in a suicide prevention Lynn. And when I really thought about that and thought about psychiatric urgent care, if you sort of peel away the onion of psychiatric urgent care, what does it really come down to? And if we want to think about this, it's a really vital connection that's going to occur at a time of significant need and vulnerability. So today, when we talk through all this, and we're going to talk definitely with a little bit of professional jargon behind it, but it really comes down to that moment in time where we're going to have a connection and we're going to deliver a service that's going to be really vital, and at a time when someone's truly vulnerable and definitely needs some direction and some connection. So what is psychiatric urgent care here in the context of Sheppard Pratt? We provide a psychiatric level of care examination, which is also known, if you work in the medical field, as psychiatric triage. We provide a one-time evaluation for individuals who are in some sort of crisis or who are seeking a recommendation for the level of care. Crisis, again, that is really a personal thing. Someone's crisis, and we see such a wide variety, and we'll talk at the end of the presentation and give some examples. What we see are people who are coming in who oftentimes they know that they're in crisis, they know that they're struggling, but they don't necessarily know where to turn, where to go, where to get help. Or perhaps it's somebody who has received help in the past and has some idea about maybe what it is they might need at this time, but don't have an easy pathway to be able to gain that assistance. And psychiatric urgent care is really the great option at that time. Our staff who provide the level of care evaluations come from a variety of professional backgrounds. We are led by two psychiatrists, Dr. Eskander and Dr. Hodzic, but we also have a number of other psychiatrists who participate in the clinic, either on a full-time or a part-time basis. The bread and butter of the folks that are providing our services are psychiatric nurse practitioners with significant experience, having worked oftentimes on inpatient units and outpatient settings. We also use licensed clinical social workers and licensed psychologists. What's really unique about psychiatric urgent care as we deliver it here at Sheppard Pratt is that in addition to being able to provide a level of care evaluation, a full assessment to really give the guidance to an individual about what the next step is that's required in their care, we're also able to provide linkages to care through our Care Connect service. And again, I think that's really key to the service that we're able to deliver here at Sheppard Pratt. When we look at the history, obviously I was only been here for the last year and a half, but urgent care actually started back in 2011 here on the campus of Towson. And as I understand it, I'm fortunate enough to work with somebody who was here back in the beginning. And it literally started as one psychiatrist for a half day a week, working with one case manager. And it was really just a little idea that we have people coming in that are scheduled for urgent evaluations, but sometimes people just need something that has to happen immediately. And that was really the beginning of what was then known as the crisis walk-in clinic. One of the things I found coming here, like many organizations, Sheppard Pratt was used to using a lot of acronyms. So it is also known as the quick clinic or the crisis clinic or the walk-in clinic. And while we go by all those still, it is known as psychiatric urgent care. Located right here on the Towson campus in the building where we also have our inpatient units and our residential care. Why it was created in that was in demand that we felt here within the organization itself, but also that it's in recognition of the fact that there's a large demand for behavioral health care in emergency departments. And this is not unique to Maryland by any means. This is a nationwide issue in crisis, in that across the country, we're finding that people don't know where to turn, and they do end up going to emergency departments who sometimes are not able to serve them because they don't have specific psychiatric resources, or those resources, are quite limited. So the development of urgent care is in reflection to our own needs here at Sheppard Pratt, those of the community, but also in recognition of what is happening across the country. We wanted to look that we would find a way for people to be able to access this level of care, the evaluation in an emergent situation, in a direct and efficient manner. In 2019, the Maryland Hospital Association found that close to half, 42% of emergency department patients that came there for a psychiatric evaluation oftentimes ended up waiting for upwards of 20 hours to be able to be evaluated, assessed, and when they needed inpatient care, to be able to transfer into an inpatient bed. And the roots of urgent care here at Sheppard Pratt is to be able to do that in a more efficient manner because we have solely dedicated resources to psychiatric care. Some of the recent updates from our initial opening back in 2011, one of the things that we all know throughout the country is that the pandemic that we have all faced has truly exacerbated the need for behavioral health care. I think if there's any tiny little bit of a silver lining to what we've all gone through with the pandemic, and so many awful things have happened, is that there surely has been the recognition that there is nobody in this country that is exempt from the impact of, emotional impact of COVID-19, the depression, the anxiety, the reaction to loss and stress that we've all had. And we certainly felt it here in this city, in this state, and here at Sheppard Pratt as we've expanded what we've been able to offer during the COVID pandemic, when we went from doing solely in-service, in-person evaluations to doing telehealth evaluations. In the middle of 2020, statistics came out that 1 in 3 adults that were surveyed reported some symptoms of anxiety and depression. And nearly half of individuals in that vulnerable age from 19 to 29, according to the CDC, were experiencing this. Now, we know by general statistics that 1 in 4 adults sometime in their lifetime will be diagnosed with a mental illness. So when we go from 1 in 4 to 1 to 3, that's a very significant increase. As I already mentioned, in response to the pandemic, the urgent care very quickly was able to pivot from doing strictly in-person visits to being able to offer telehealth evaluations. And I'm very happy to say that's something that we have been able to continue to sustain, and certainly look forward to continuing to do even as the pandemic begins to abate. In July of 2021, we did rename ourselves from the Crisis Walk-in Clinic to Psychiatric Urgent Care. That really was in response to the fact that not everybody who comes through the door is in a true crisis as might necessarily be defined. in the psychiatric literature, but that people feel an urgent need to seek care, but don't necessarily know where to go. So we want people to know that they can come through our door, even if in that moment they are not in a crisis in the sense that they are at that moment acutely suicidal or homicidal or unable to care for themselves. Part of psychiatric urgent care is obviously we deliver a terrific service that helps the individuals, the families that come through our doors every day. But we also see ourselves as doing a little bit of a community benefit in that the individuals who come through our doors that ultimately need that inpatient level of care have managed to bypass having to go to an emergency room. So while we're here, first and foremost, to serve those individuals who are coming through our doors, who are seeking help, we also have a secondary benefit of helping to relieve some of the pressure on emergency rooms throughout really Maryland, and particularly in our area. We have 2 neighbors that are literally a walking distance from our urgent care. Who do we serve? We serve a very wide variety of individuals, and Dr. Eskander and Dr. Hodzic will go into this in greater depth than I will. But we do serve children, adolescents, adults, and older adults. Anybody can come walking through our doors. A certain percentage of people do come in because they have been encouraged to come here. Sometimes they have a therapist in the community, a social worker or a psychologist who has the feeling that this person that I have a therapeutic relationship with is going to need something more than I can provide to them at this period of time. And they're able to say, you know, why don't you go to the urgent care clinic? It's a great opportunity to get further evaluation and access another level of care. We also get a lot of primary care physicians, internists, who will recommend, you know, I've done what I can to help you at this point in time, but you need to access specialized care from a behavioral health professional. And oftentimes coming through urgent care is a great place to start. We can do that level of care evaluation and help the patient, the family, and the primary care physician really determine what is the next step that is necessary. We also get referrals from psychologists, nurse practitioners, social workers in the community who know that their patients may need something beyond what they're able to do. Certainly schools, particularly at this time of year, when kids have settled in to their classes, they're beginning to feel the stress that comes, unfortunately, with school and the peer relationships and the demands of school. We see a lot of adolescents and children coming through our doors in September and October. And again, it's a great resource for schools. And anybody can really walk through the door. We do see people who may have been to us before, several years ago. Things have gone well. During the pandemic, perhaps situations have changed. There have been health situations, financial situations. They're feeling stress, and they know that they can come back to urgent care at any time. We do have the caveat that the people that we serve through telehealth do need to be physically located in the state of Maryland. And that is really kind of the only caveat. Anybody can walk through the door here as long as they're physically coming to us. And again, what just sort of reflective of what I've already said, we do see a high percentage of children coming through our doors this time of year. And looking at the numbers in 2020, psychiatric urgent care, we completed 6,618 level of care evaluations. Last year, this fell into 2 buckets. About 4,700 people were evaluated in person in our clinics, and the remainder through our telehealth platform. And through these over 6,000 evaluations, we had just short of 2,000 people who ended up admitted to an inpatient bed. As we've moved into this year, through the end of September, we are at 5,716 evaluations. I can say that we have seen, particularly as we come into the fall, startlingly high numbers of evaluations coming through. As I already said, we get people from all over the state of Maryland who both physically come into us and also who take advantage of our telehealth platform. And this map can show you broken down by county where our patients are coming from. You'll see 2 pins on the map. The green pin is our Towson location. And then the blue pin is our new location, and that's our Baltimore, Washington campus in Elk Ridge that opened in July. So psychiatric urgent care is new. So we are definitely looking that as we go through this year and people become familiar with that location, that we hope that we will be able to draw additional people from counties to our south. As you see, we already had people coming to us from Anne Arundel going down to Prince George and Charles County, and it's a great opportunity for people to come up to Elk Ridge now that we are have an office there. I made some reference to this at the beginning of the presentation, connecting to care. One of the unique features of coming into psychiatric urgent care is that if you need outpatient services, our urgent care then makes a connection to Care Connect, which is our internal case management service. I've put the telephone number up there. It's also on our website. You don't have to come through urgent care to reach out to Care Connect. Sheppard Pratt is a huge organization covering the state. As we said, we have 160 programs at 380 sites across 16 counties. This includes schools, this includes outpatient services, partial hospitals. We really have the full gamut, and Care Connect is really the place to call if you need to know what's in your neighborhood and how we can make those connections. And Care Connect works on behalf of urgent care for people who come in who need outpatient level of care to help us to identify a resource that would meet the needs of individuals. So again, it's on our website as well. Our locations, we've had our initial location here on the Towson campus in the Weinberg building. We are currently a 6-day-a-week operation here, Monday through Friday, and we also have a half day on Saturdays for walk-ins. Our newest location, which is psychiatric urgent care on the Baltimore, Washington campus in Elk Ridge, is currently open 5 days a week, but we're very happy to say come November, we will be adding Saturday hours. And that our goal within the next year is to make that a 7-day-a-week operation. As I've already referenced, psychiatric urgent care also has a telehealth platform. Again, this is on our website as well, and that we do provide telehealth evaluations through the Zoom platform. People who are being evaluated do need to be residents in Maryland. We do get requests sometimes for Virginia and the DC area, West Virginia, and unfortunately, we aren't able to honor those. We do need people to be in Maryland. The one difference about the telehealth evaluations is these are scheduled. These are not on demand. People do have to put in a request and we do schedule them. Generally, we're able to do most evaluations within 24 hours. And for those of you that may not have ever had the opportunity, here's one small picture of our Towson location. Our Towson location does have public transportation, which I think is really key. We are share grounds, literally elbow to elbow with Towson University, and also on another side, Greater Baltimore Medical Center. And our newest location, which has been my background today, is our new hospital, the Baltimore, Washington campus in Elk Ridge, where we have an urgent care. It's a beautiful, beautiful new building that opened in July. We have 5 inpatient units here serving young adults, co-occurring individuals with primary thought disorders. We have our urgent care clinic, and we're also establishing day hospitals at this location. And the picture in the upper right-hand corner actually shows you the inside of the urgent care clinic. And now I'm going to turn over to my 2 clinical colleagues to talk in more depth about who it is that we evaluate, what happens during an evaluation, and to give a few examples.
Thank you, Lynn. That was a great background, an overview of our psychiatric urgent care. So yeah, I'm Dr. Eskander. I work in the psychiatric urgent care at the Howard County location in Baltimore, Washington campus. We really would love to serve, everybody that is seeking care. There are a few requirements that we have. So the first one is that the individuals must be voluntary when they are seeking the evaluation. So we cannot see folks that are coerced or involuntarily brought in by the police, for instance, against their will. So this is really a clinic open to anybody who is actually seeking evaluation and treatment kind of on their own. Individuals must be free of drugs and alcohol in order to be evaluated. So if there is concern for intoxication or that an individual is kind of under the influence, we're not able to do an assessment. Along those same lines, individuals must be medically stable in order to be evaluated. So if there's any very concerning like medical issues that are active at that time, we don't have the resources in our outpatient urgent care setting to really be able to manage that, and those individuals should go to the emergency room. And then along those lines, this is an outpatient setting, so individuals must be able to safely wait in order for their evaluation. We can see anybody ages 4 and up, and so really anybody pretty much within the lifespan. Children must be accompanied by a parent or someone who has legal authority to consent to evaluation. If that guardian is not the parent, they must provide proof of their status, and they must bring that paperwork in order for us to be able to see the child and adolescent. Next slide, Lynn. So just a little bit more depth about things that we're not able to do because we really want to serve everybody and get them their needs met. So as I mentioned, individuals that arrive on emergency petition status or those that are unwilling to be evaluated, we cannot see. They do have to consent to treatment. Individuals that have received court mandated evaluations, we cannot fill those out or do those. Likewise with folks seeking disability or FMLA paperwork, those need to go through their primary doctor or psychiatrist, but we cannot do those in the urgent care setting. Similarly, we cannot fill out return to work or school clearances. We can certainly evaluate folks that are having issues at school or work, but we cannot actually do a actual clearance to send them back. Youth in DSS custody. DSS cannot actually sign consent for a patient to be evaluated like otherwise a guardian would be able to. So we would not be able to see youth in DSS custody. And then individuals that would likely be admitted to the geriatric unit, our neuropsychiatric units, both youth and adults, or anyone that is medically unstable would be required to go to an emergency room in order to get medical clearance to be admitted to those. And then we do have some specialty units at Sheppard Pratt, which sometimes individuals are seeking treatment either on our trauma disorders unit, our eating disorders unit, or at the retreat. We do not do direct admissions to those units from psychiatric urgent care. So if there is somebody seeking a specialty unit, there are specific admissions processes, which at this time we're not going to get too much into, and we can certainly provide that information, but they would not go through psychiatric urgent care. And lastly, I just want to share that we do not do medication refills or changes in psychiatric urgent care. Next slide, Lynn. So we'll kind of walk through what happens, what to expect when you arrive, during the assessment, and after the assessment. So when you arrive at urgent care, remember this is an outpatient based setting. Individuals are wanted by security for any dangerous items, and those would be locked up for the duration of the visit. Some people have some preconceived notions about what they would wear or anything like that in a psychiatric setting, but you will stay in your own clothing. We don't ask for any change in clothing or anything like that. You'll be asked to register and fill out some basic questions at the beginning of the visit, just like any other doctor's office, and then you will be assessed by the provider. So the provider will meet with you and they will ask you several questions during the assessment. So they will ask you about your reason for coming in. They always do a safety assessment. They'll ask about your past psychiatric history. So, you know, where have you been hospitalized before, if at all? Are you connected with treatment? Those sorts of things. They'll ask about your medical history, and then they'll ask about your day-to-day activities. What is your daily structure? What kind of work do you do? Things like that. And I will pass on the presentation to Dr. Hodzic.
Thank you. I'm Vedrana Hodzic, and like we've said before, I'm the service chief for the Psychiatric Urgent Care over here at Towson. So I'll be talking about what happens after an assessment. So once the individual and the provider meet, there'll be a discussion about a level of care recommendation. So going back to that model, this is really kind of a triage, and we're thinking about where would this patient be best served and how do we get them to that location. So in general, with psychiatry, we essentially have 3 levels of care that we want to think about. So there's the most restrictive, which is inpatient psychiatric care. Outpatient would be the least restrictive, and then some sort of day hospital, partial hospitalization, IOP models that are in the middle. Sheppard Pratt does offer all 3 levels of these services, so I'll go through each of them briefly. So with inpatient hospitalization, what we're looking at is really acute crisis stabilization. This is generally about a week long. It is on a secure locked unit. You're getting daily medication management, seeing a psychiatrist, seeing various groups in a team setting, and also getting some basic group therapy that you're able to sort of tolerate while in an acute crisis. The next level down would be the day hospital, or also known as partial hospitalization services. These, again, are sort of in the middle ground. It is someone that does need more kind of acute services than outpatient can handle, would be doing medication management, but again, doesn't need kind of that close monitoring on a locked unit setting. So here you would also get the medication management, but then the group therapy services are really the bulk of what you would do, since, you know, the acute setting, you've sort of kind of either didn't meet that requirement or things have calmed down, so you can actually participate and get some benefit from therapy. We actually have a number of these services at Sheppard Pratt, so both for the child and adolescent group, general adult, but also psychotic disorders, so people that have schizophrenia, schizoaffective disorders, severe bipolar disorders would fall into that category. And with COVID, we've also expanded these services not only to the inpatient programming, but also to virtual programming as well. In terms of the structure of this one, it is a weekday, so Monday through Friday, generally takes up most of the day. So starts around 8, wraps up around 3, and then you get to go home and sleep in your own bed compared to being on an inpatient unit. This one is generally thought of as about a 2-week commitment, but there's flexibility in that depending on what's going on and what sort of medication titrations need to be done. Next slide. And then we get to the outpatient setting. So like we mentioned, we have a huge network of clinics across the state. If an individual is seeking to get connected to outpatient providers, doesn't have providers, needs, you know, has a psychiatrist, wants more therapy, we can get them connected to this. So we have both medication management services, therapy services, as well as can provide both. And this is, again, kind of the span of the full range. So children, adolescents, adults, geriatric populations, some subspecialty services as well. And essentially we would place a referral, and that Care Connect team would then seek out where they could have an intake that's rather quick, that would take their insurance, local to the individual. This is not really kind of a level of care, but is one of the disposition options that may happen from psychiatric urgent care, and that is sending someone to the emergency room. So if we find, for example, that They do need inpatient admission. However, they have a lot of medical complexity, especially with kind of, again, those geriatric populations. We would need to send them to the ER to do medical clearance. We don't have the capability of doing lab work here on site. Additionally, if someone doesn't meet the criteria for inpatient, but we don't have a bed available, then again, we would have to refer them to the emergency room, since, as we've sort of been talking about, we are an urgent care center, but it is an outpatient service. So we don't have a space that we can hold people 24/7. Next. Okay, so now I wanted to go through some common examples that we see in how we think about folks and who might be best served from our services. So in this first example, we have an 8-year-old child that's being referred by their pediatrician. They've been having some problems paying attention and sitting still in school. The teacher and the pediatrician are concerned that the child may have ADHD. The parents and the pediatrician have tried to get them in somewhere, but they really haven't been able to find anything that's quick. It would take several months to get plugged into their regular resources that they've looked into. So if they were to come into psychiatric urgent care, when we assess them and find out this information, there's no kind of acute safety need that we have to bring them into the unit for. We would determine that they would be appropriate for outpatient level of services and get them connected to what they've been seeking, which is that outpatient psychiatrist in therapy, which again, we would go through Care Connect. And the goal is to really get people into a clinic with an intake specific date and time within about 2 weeks. Yeah, there we go, example 2. So in this scenario, we have, now an adolescent that has depression, isn't being treated with medications, has been feeling really sad, having crying spells, trouble sleeping. They're not having any suicidal thoughts, haven't done anything to harm themselves, but you've noticed that there are changes in how they're functioning, not really doing as well in school. So this person seems like they really need kind of more urgent assessment and management of medications more acutely, especially since they're not functioning as well and would benefit from some structure. However, they're also not to the point that they really need to be behind locked doors to get management and services. They're still able to maintain safety while at home and participating in these programs. So this would be a great person to refer to the partial hospitalization program. Okay. Then we have an adult, 35-year-old with schizophrenia that has been seeing a psychiatrist. The psychiatrist notices that they've been having worsening auditory hallucinations, which are actually command in nature, so actually telling them to stab himself. The patient is, having these symptoms. You can see they're acutely psychotic, but still has some level of insight that they understand that there's something going on, they want help, and are willing to trial medications. So this is someone where it would be appropriate to send to psychiatric urgent care, since again, they're coming of their own free will. They understand that they do need treatment, compared to someone who has no insight, is kind of saying, no, I don't need help, which you would have a difficult time on your own getting them to us anyway, but that one would be more appropriate for the emergency room. So when we would see them, they would be appropriate for voluntary admission. And if we have a bed available, we can get them admitted directly from urgent care, again, kind of with these assessments. And the goal of treatment is really about getting them seen, evaluated, and up to a unit within an hour's time. And finally, we have an example of a 45-year-old also presenting with depression. However, you're noticing that they're not really walking steadily. They're slurring their speech. They're kind of loud, belligerent, and they tell you they've been drinking. So this person is acutely intoxicated, and while they're does seem to be a mental health crisis. Unfortunately, in that state of intoxication, we can't reliably evaluate them. And since we don't have the medical backup, we are also not able to monitor their symptoms and the withdrawals that may be associated with what's going on. So that person, we would have to get to the emergency room. And then we wanted to just share some comments that we've gotten from patients and families about our services that they found very beneficial, and we definitely are here to serve the community.
I think we have a few questions that have been forwarded to us through the chat function. Okay, so the first question that
Jody, I'm sorry. Let me make
a couple
of comments. I'm sorry, I was muted, and anyway. So I do want to thank our presenters for this great presentation. We will now open the workshop for questions, and we've received some. Thank you for posting, and if you have a question, go ahead. Just a reminder that if you're going to post a question on the social wall, there's a 20 to 30 second delay before we'll see it. If you don't have time to answer questions today, please send your questions and the name of the session you attended to connection@namimd.org. So what I'd like to do now, we'll just take these in order. They're very good questions. And the first one really was, how many regular urgent care centers are there in Maryland? You've shared that there's 2 of them with Sheppard Pratt, but how many others are there, and how well prepared are they to respond? If any of you could speak to that.
Sure. So as we said, Sheppard Pratt has 2 at this point in time. I do not know the extent of the number of urgent care centers, but what I can say is that over the last 6 months, we've had a number of organizations reaching out to us from within the state who are looking to be able to establish urgent care centers in other locations. So I think that this is definitely a model of care that other organizations are looking as a great opportunity to be able to service their communities, and also to be able to direct people to receive those services in a physical location that best meets their needs. Again, it's something that I think we've referenced throughout the presentation, is that there are a lot of individuals who are in urgent need of assessment, but don't necessarily need to be in an emergency department. And that's really what urgent care is all about. And how well we are prepared. We're very well prepared at Sheppard Pratt to meet the needs of people with all kinds of psychiatric issues. And I think, again, that's one of the tremendous wealth of talent that we have here, and that we are able to assess, as we've already said, children, adolescents, adults, and we just, because this is all we do, this is our specialty, we're very well prepared to address those issues.
Well, thank you. And it seems to me that other hospitals could follow your model here and expand this service. Second question, and this is one that matters to me because I'm on the Eastern Shore. Is there any chance of getting access to these services on the Eastern Shore of Maryland?
So first of all, anybody in the state of Maryland can use the telehealth for evaluation. So if you, it's in our presentation, it's also on our website. So that's the great thing about telehealth. Pandemic or no pandemic, it addresses the fact that people live, or perhaps even if they live close to us, they don't have access to easy transportation. So no matter where you are in Maryland, you can access our telehealth platform. And I'll certainly pass along the suggestion to our planning department that they'd love to see this on the Eastern Shore. I wouldn't mind going to the Eastern Shore and delivering this service because it's beautiful out there.
Well, thank you. We have a third question, which provided me with a wonderful vocabulary learning opportunity, and I'll read the question. Why must it be voluntary? People with the most urgent need often have anosognosia, which I would guess means lack of self-awareness in some sort of a really clinical sense, and their lack of awareness prevents them from seeking care.
I could start. I don't know, Dr. Eskander, you want to take that one?
Can I take that one and
Please.
couple it with the question that says, what happens if you have someone who met the requirements to be an urgent care patient, but is not agreeable to a voluntary admission? Are you able to do involuntary admissions from urgent care, or would they be sent to the ED as well? I'm going to answer both of those questions at once. I think that might make it easier. So the individual must be voluntary or must be agreeable to an evaluation to be seen. So if they do not have an awareness of their illness, but let's say their spouse brings them in or their parent brings them in and they're willing to at least sit and chat with the provider and get an evaluation, we'll see them. And we see a lot of folks like that. If we determine that they do need a higher level of care and they're not agreeable, we certainly have the capacity to or we have the resources now to certify individuals and hospitalize them if we think that they are in need of that level of care. We did not used to have that capability as much, and so we are definitely growing in that sense. So I hope that answers those two questions.
All right, that sounds good. Last question that we have posted. Is this a service I can use to find a provider for a loved one who needs a referral to a new mental health provider for medication management?
Definitely. So as I said, we get a lot of individuals who come into urgent care who use our telehealth, who may not be in an acute crisis and that they are seeking or need inpatient level of care, but a lot of people who just know that they need help but don't know where to turn. Perhaps they had an established relationship with a provider, and we found a lot of people during the pandemic that was disrupted. They've changed insurance. Again, circumstances change. By all means, the opportunity to come in, have an evaluation, determine what is the next step, and then we will assist with making those linkages.
Let me, as a clarification for that one, however, you're not providing a referral service without seeing the client themselves.
Correct.
Okay.
People can call our Care Connect if they just have a general idea of, I'm looking for this particular type of service in this physical area of Maryland. Do you have something within Sheppard Pratt that would potentially meet our needs? Anybody can call Care Connect. Essentially, that is an information and referral service. You're connected to someone who's very familiar with all our resources, but it is not an actual clinical evaluation when you call Care Connect. The clinical evaluation occurs through psychiatric urgent care.
Right. One more question, pertinent to what we were just saying. Is your primary goal to refer patients to Sheppard Pratt resources, or do you refer to resources outside of Sheppard Pratt as well?
Our primary goal is to get people connected to the care that they need. We definitely refer a significant number of people to resources outside of Sheppard Pratt. And we often find ourselves in situations, for example, if somebody is currently in care and they're struggling and they're not sure, maybe I need something more. They have a therapist in the community. They want an additional evaluation because perhaps they need partial hospital level of care, but they're not really sure. And in those situations, we refer patients, and if they don't need something beyond what their current provider is giving to them, we refer directly back to the provider. We can do a lot of things. We can't do everything. But again, it's a great resource.
And I imagine that if you're doing telehealth with someone who's in Chestertown, for example, where I live, you're going to have access to local resources that aren't Sheppard Pratt resources, but might be more convenient.
Right. And part of what our Care Connect staff does is they work to remain tuned into the resources throughout the community. And we'll do some research as well for individuals to help determine other connections that might not be within our own system.
Super. Here's a question. Do your urgent care providers have any restrictions on medications they can prescribe? In California, psychiatric urgent care providers are limited, which can cause a problem when the patient just needs medication management.
It's like,
Yeah, I can take that
Okay.
one. Yes.
thank you.
So in terms of what the providers can in theory do, in terms of their licensing and everything and credentialing at Sheppard Pratt, they don't have limitations. However, we do not provide any medication management services directly from psychiatric urgent care. This is just that assessment, and then we will link them to a medication management provider.
That's an important clarification.
Yeah.
Well, not seeing any additional questions. I do want to remind folks, if they haven't had their questions answered, if they think of one later, they can contact connection@namimaryland.org. It does seem like we're running close to the end of our time. So I really would like to thank our presenters. This was really informative. It let me know about something I was not at all aware of. Really nice part of the system of care for folks. I want to thank our audience for joining us today. As a reminder, when this workshop session closes, you'll be prompted to fill out a brief survey. If you'd like to receive CEUs for this workshop, you must complete this survey, and we really urge you to complete it. It'll be really helpful for our planning. The next workshop session is scheduled to begin at 11:20 a.m. So be sure to check out NAMI Land and other amazing virtual resources in our virtual exhibitor hall. Don't forget